Hello friends, welcome to HELP, Honeymanian Education and Learning Platform. Today we are going to discuss a case of a child of global developmental delay where the child's all milestones were delayed and the child came to us with a complaint of speech delay. Now I'll just present this case in very short. This is not about discussing the remedy of the case, but describing how you enter into the case and how you differentiate remedies. So when we probed history, we realized that the case is of a global development delay and not of a speech delay, and hence we thought of taking the patient's mother's history during pregnancy as most vital to prescribe. So we probed into the patient's mother's history. That means we asked the mother what was the major stress during the pregnancy and more so during the second and the third trimester of pregnancy. Now the mother described very important aspect of her stress, that she had a lot of fear during the pregnancy. This was the second pregnancy, and during this pregnancy, the in-laws, especially the mother-in-law, was very aggressive towards her. She was always very angry and used to always shout on the mother. She used to throw utensils in the house, and that noise of utensils used to scare the mother a lot. So throughout the pregnancy, the mother was very scared. She was so much scared that she even feared to go out of the room. She even feared to go to the washroom, and she always avoided if she sees the mother-in-law. And whenever the mother-in-law was not around, she used to go to the washroom. And the sensitivity to the sound was so marked that the patient always was having the fear. So this we realized that the fear factor was very strong during the pregnancy, and that might have led to the child expressing the symptoms of global developmental delay. Now the remedies which came to our mind initially was, as you all must be knowing, that stramonium. We thought that this child would require stramonium. But now we probed into history a little bit more, and then I asked about the delivery history, because I was also expecting that there must be some trauma during the labor, during the delivery. So we asked about the delivery history, and the mother said that there was oligohydramnios, and hence this child was delivered prematurely at the 8th month of pregnancy. And so a C-section was scheduled, and the mother delivered the child through C-section. Now what interesting point the mother said during this process of delivery, that the child was not ready to come out, which means I'll explain you exactly what the mother said in her own words. So the mother said that the child did not wanted to come out. उसको जबरदस्ती पेट से निकाला, पानी कम हो गया था, which means that there was oligohydramnios, and the doctor said that उसको जबरदस्ती पेट से निकाला. That means in spite of giving a C-section, they had to struggle to bring the child out of the womb. वो निकल ही नहीं रहा था, उसको खींचा हमने. Doctor said वो निकल ही नहीं रहा था. They had to pull forcibly the child out of the womb, and the child was premature child. The child was very small. The child had not many facial features. The eyebrows and the eyelashes were not there, and then the child was kept in NICU. The child did not take mother's feed. Child was refusing feed, and he was kept in NICU and was given top formula feed. So friends, this was very interesting for us, that why was the child not ready to come out, and then correlating with the stress, we felt that the child was also in a state of fear, and the child feared as the mother was not wanting to come out of the room, fearing the mother-in-law. the child had similar kind of an expression where the child did not want it to come out of the womb. Now this was very, very, very striking and peculiar to us. And then I asked more about that. What was her experience during the pregnancy? The mother said very important symptom. The mother said that in my first pregnancy, the child was moving in the abdomen. She could feel the sensation of the movement of the child in the womb. Whereas during this pregnancy, she did not feel any movement of the child. She felt as if the child is not there, the child is not at all moving. And this was very strangely which she felt. Because this was a second pregnancy, she could compare the movement of the child, this second child, compared with the first child. So again, this was very important characteristic which we want, that the child did not move. And after the child was delivered, now the patient came to us, the child came to us with a complaint of global developmental delay, speech delay, and hyperactivity. The parents complained that as if the child has got wheels in his legs and he is constantly moving in the house. He is constantly moving, he is not at all stable in the house. So friends, what was the remedy you think of? Yes, the first remedy which came to our mind was stramonium, and we were almost on the verge of giving stramonium to this child. But when this mother explained this symptom of the child not moving during the whole pregnancy and the child has to be forcibly pulled out of the womb, we changed. We thought, no, this is not stramonium. Why this is not stramonium? And this is the way you have to differentiate remedy. This is not stramonium because whenever the stramonium child is exposed with the situation of fear, the child becomes very scary, the child clings, and the child becomes very, very, very restless. Whereas now here the child was not. So the situation of stress was there, the situation of fear was there, but the reaction of child was not moving at all. And hence we did not prescribe this child stramonium and we prescribed this child opium. Yes friends, opium, and this is exactly the difference between opium and stramonium. Both are very good remedies for ailments from fear, but the reaction of opium is slowness, numbness, whereas the reaction of stramonium is like a panic reaction where the child becomes hyper excitable and the patient becomes super energetic. Opium reaction is more of a numbness, of slowness, of dullness. Hence, opium is, if you see in my Materia Medica, Essence of Pediatrica, we have described opium as a hypoactive remedy and the stramonium as a hyperactive remedy. So friends, just prescribing on one symptom of ailments from fear, stramonium is not going to work. You also have to see what was the reaction. So the prescribing is see the ailments from and also consider the reaction. This combination is going to help you. So stramonium is hyper, opium is hypo, and that is why the fear factor was there. The mother was scared. Sensitive to noise, again that is a hallmark for opium. So the child went into complete numbness, as if something is happening. Child did not move, and now the child complains of hyperactivity. The primary presenting complaint is hyperactivity. So situation where the primary reaction was slowness, hypoactivity, numbness, and then the secondary reaction was hyperexcitability. And this is a very important feature of opium where we have primary action and secondary action both mentioned in our Materia Medica. Opium has got constipation alternating with diarrhea. So this kind of different exactly polar symptoms are present in opium, and we prescribe this child opium and not stramonium. Friends, you have to get good success in homeopathy, good miraculous result in homeopathy, then you have to go to these finer points and differentiate remedies. I hope this was an interesting aspect of differentiating between stramonium and opium. Thank you very much for watching this video. Thank you.